with the theme Childhood to Adulthood, Communication and Social Development. The 7th edition of the annual Autism Conference was held at the Digital Village Alausa Ikeja to create conversation and develop resources to address the dynamic needs of people living with autism, starting from their childhood to adulthood.
There is no one test for autism. There is no blood test that is going to be done. There is no laboratory investigation. It is essentially a clinical diagnosis that is made by a skilled expert in the field. And also, the diagnosis is not a one-stop visit. So we must think about what is our culturally appropriate language that will help us to get the right responses from our parents and from the child themselves.
The first edition of the event was organized in 2009 as part of GTB's Orange Ribbon Initiative program, designed to give support to people with developmental disabilities and special needs, most especially those living with autism.
The most valuable thing, I believe, is information. Early identification and diagnosis can make a life-changing difference, and this can only start with the right information. So we have, as the doctor said, to be very careful and not just make it a one-size-fits-all.
The 2017 edition had partners supporting the program, amongst whom were the Blazing Trails International, Texas, USA, the College of Medicine, Idiaraba, Patrick Speech and Language Center, the Ministry of Health, and the Neuropsychiatric Hospital, Aro, Ogun State.
Maybe a child with intellectual disability, you are now mistaking him or her to have autism spectrum disorders. So you have to do a thorough diagnosis before you can prefer a solution or before you can describe what solution will be. If there is no thorough diagnosis, we are going to have a wrong solution. We need to be very, very careful.
Pictures of yourself also at different stages of your life would help the person with puberty, because the person says that, oh, mom, is that really you? So you were once a baby too, or daddy, you were once a baby, you're now this, you're now, and you've gradually grown. So you let them know that this is a natural thing, it happened to me too, it's happening to you, and it's actually a beautiful feeling. And of course, you have to be very sensitive, and you have to be highly understanding, and of course, most importantly, you have to love, and love them.
One of the symptoms of autism, as well as some other disorders, is the difficulties with understanding verbal communication or communication in general. So in order to assist with that, visual supports can be used. And sometimes visual supports are used in the form of photographs, drawings, or words, or even objects.
Present at the conference were renowned specialists who were there to offer professional help and advice.
For the parents, it's like a relief, because some of them are at loss on what to do. They don't know what's happening with their children. In the time past, a lot of children have been wrongly labeled, in quotes. We have cases of people that have been called Ogbanje, Emere. From today's discussion, you realize that a child with autism, not necessarily an Ogbanje child, not necessarily interacting with a spirit world. No, this child have issues with speech and language problem. This child have problem with social interaction.
We need to teach the children from childhood, teach them the skills as they grow older, to become adults, responsible adults that will not be a burden to their families and to themselves and to the community.
It is not a disease that is concernable, that you say, okay, it's a disease, if I go near this person I might catch it. No, it's not a disease. It's just a syndrome. For every one of them, they are special. So being able to harness that specialty in that child and let the child showcase it.
When you have a child who has a disability, it is not your mother-in-law, it is not your neighbor who's done it, it is not God, it is just what has happened. And I believe that the more we bring these children out, the more the society begins to accept the differences in us.
Some parents spoke on the challenges of parenting an autistic child and how to overcome them.
People should just take them with love. they should relate well with them because they did not create themselves. And even the parent that they are the mother or the father, they did not pray for that kind of behavior. But when it comes, we have to take the child as coming from God, so we must relate very well with love with the child.
How can they be able to socialize with the community so that we can move them forward from where they were? You know, they can improve from the standard where they were before to a higher standard. So that's why that is the essence of this program, so that to be able to educate them, to educate the parents on how to take care of these children.
First of all, he wasn't talking, and he was behaving or abnormally and all that. So we were advised to take him for some tests and all that, and he was diagnosed with autism. And autism it has not been a very easy road, and with all the therapy he's been going through and all that, there's been a lot of progress. So I would not even advise anybody that has a child with any form of disability to relegate the child or leave the child at home, because you'll be losing a lot.
I'll take it back home that every child who has this spectrum disorder, ASD, what you have as a mother should just try to, though it's not easy, this is what every mother faces. Try to love, be patient with the child. With this, I think that is enough therapy that you can able to give to your child as a mother.
With this kind of program which GT is actually organizing, is helping children like this, to be aware of what to do and how to do it, and parents like us also, because with this we are now clear, we have the clue of what to do. Unlike 5 years ago, 10 years ago, when we do not have the clue on what to do concerning them, you're clueless.
Parents with children living with autism and other disabilities have been urged to bring these children out and not hide them away, as early intervention will help these special children cope better with their challenges.